Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Nutcracker's esophagus. So, in the Nutcracker's esophagus is actually a hypermotility disorder. Nutcracker's esophagus is a hypermotility disorder, and thus this Nutcracker's esophagus is also known as super squeeze esophagus. Nutcracker's esophagus is also called as super squeeze esophagus, where here the esophagus is present with hypertensive peristalsis. So here along with esophagus there is presence of hypertensive peristalsis is seen with high amplitude contractions. Here there are high amplitude contractions are seen, which is called as Nutcracker's esophagus. So one important one liner is Nutcracker's esophagus is the most common and most painful esophageal hypermotility disorder is called as Nutcracker's esophagus. Because it is hypermotility disorder with increased peristalsis and with increased amplitude contractions, so as a result it is associated with hypertrophic musculature, which is responsible for high amplitude contractions. So because of this hypertrophic musculature and high amplitude contractions, the patient mainly presents with chest pain, and dysphagia is common in these patients. And on diagnosis, so when you see the diagnosis, all esophageal hypermotility disorders, the gold standard for diagnosis is mainly by the manometry. Okay, but here you see two things: the patient should have chest pain, and after along with the chest pain, if you do a manometry, and in the manometry if you see you have done an esophageal manometry, and in the esophageal manometry if there are esophageal contractions are present, which is high amplitude esophageal contractions are present, two standard deviations above the normal, then we call it as esophageal Nutcracker esophagus. Nutcracker esophagus. The amplitude will be more than 180 millimeters of Hg, and the duration of contractions will be for more than 6 seconds. Then how are you going to treat this case? Then treatment is obviously it is a medical therapy where we give antispasmodic agents, calcium channel blockers, and nitrates can be given to the patient for Nutcracker esophagus.
thank you and thank you for watching.